Good morning. Members of the committees, I'm so happy you're here today. I am Tracy Warren, and I'm with the Idaho Council on Developmental Disabilities. Individuals with developmental disabilities who are eligible for Medicaid home and community-based services developmental disability waiver have been able to use community-supported employment services for job coaching, support on the job site to learn work skills, understand daily tasks, and build relationships with supervisors and coworkers to be successful in employment. Often job coaching by a support professional is more intensive at first and then is reduced over time as the person becomes more independent on the job or as natural supports may be developed. However, some individuals may need long-term employment support. With reductions to individual budgets for Medicaid services in recent years, data shows a significant reduction in the number of people who are using community-supported employment to support them to maintain their job. In 2011, the legislature passed House Bill 260, limiting the department's response to individuals' requests for budget modifications to only when health and safety issues have been identified. One unintended consequence was that individuals who had been able to use some of their Medicaid service budget to pay for employment support in the past and had recently had their budgets reduced were no longer able to request a budget modification to continue using those services. Without at least a limited amount of support, some individuals have been unable to keep their job. 275 individuals were using community-supported employment services in March 2011 prior to the July 1st implementation of House Bill 260, with expenditures totaling a little over $1.6 million. The following 2 years, there was a steady decline with only 182 individuals using the service with expenditures of around $970,000. And that was in March 2013. That is a 33% decrease in the number of individuals using the service and 41% decrease in expenditures. During that same time period, the wait list for state-only funded vocational rehabilitation extended employment services program increased by approximately 191 individuals, from around 363 in September of 2011 to 561 in September of 2013. A work group of members of the Idaho Employment First Consortium and the Collaborative Work Group on Adult Developmental Disability Services has been meeting with policymakers and Medicaid to discuss amending Idaho Code 56-255 that describes when the department will allow budget modifications. We would like to amend the law to include language that would allow budget modifications not only to protect health and safety, but also to obtain or maintain employment. Thank you for hearing me today. I appreciate it.
Thank you for coming. Mark Mayfield. And then we'd like to hear from Dan Hymas and David Lonsberry, and Laura Scurry. Mark?
Good morning. Chairpersons and committee. My name is Mark Mayfield, and I'm a licensed social worker. I work with Stepping Stone Services, agency that provides case management, which is really, service coordination and plan development. Well, I'll give a couple of examples. I'm talking about employment supports and advocating for that, and a couple of examples. I'll just use first names. I have a client named Josh, and his DDA company is Life Incorporated. And the problem is that hourly supported people don't get employment services at all, because it's just not going to happen. The budget's not going to be there. So as it is. High support, you have to, a year that you have high support, go down to hourly to open a VR case. And the reason is because VR will not open a case for DD waivered clients unless they have job coaching money on the budget. So what you do is you open a case, and then they can have a case after that. Of course, they'll lose because now they're on hourly. Their next budget will be low, so then they won't have the money to sustain the job they got if they need, the job coaching. But anyway, so Josh, what it is life doesn't want me to cut him to hourly, but I need to, before he loses high support, while he has a budget to be able to transfer into that CSE. Anyway, and then I have another client, Support Living His Way. His name is Paul, and His Way is actually doing an amazing thing. Now, Paul works at 2 different Zamzos, lifting the heavy bags of dog food and, the lawn treatments, garden treatments, and whatever. And he also works at BSU, and he keeps the sub clean, wipes the tables, and picks up garbage on the floor and stuff like that. Anyway, His Way does, in order to keep his job and keep him on high support, so he qualifies for high support, Paul. But in order to keep his job, what the team has decided, and His Way is very gracious in doing this, is that His Way works for free 46 days a month. So, and which means they lose $11,426.40 a year. So we can say, wow, well, I don't know all the DDAs do that, but I don't know how they do that. So, but I had to assure the care manager that, yes, we will give him high support all year, even though the days, because you put the days on there, are 319 instead of 365. So.
Thank you, Mark. Your time is up.
Okay, and then it helps behaviors and stuff like that too.
Okay, thank you. Dan?
Good morning, Committee Chairman and members of the committees. My name is Dan Hymas. I am the business manager for a mental health agency in southeastern Idaho. We drove over here today to share with you our thoughts about the mental health managed care and the problems that is provided to our agency and the clients we serve. We provide substance abuse counseling, mental health counseling, CBRS, formerly PSR services, and case management services. Since Optum has taken over the management of mental health services, we as providers as well as our clients feel that we have been kept in the dark regarding the changes that are being made to services we provide. When we call to get our clients authorized or reauthorized with the Optum Care line, frequently we're on hold for 3 or 4 hours before they even answer the phone to address our concerns. After that, we are then told by Optum Care managers that the services we've been providing for the past decade or more are no longer appropriate or medically necessary for our clients. One example of this is case management services. We've been recently been told by care managers that the only role that a case manager plays is referring a client to service providers, and then the job is done. There's no monitoring to assure that the referral is a good fit or that the client can access the resource. There's no problem solving to figure out what to do when difficulties arise. Once the referral is made, the case manager's role is complete. It is then only after speaking with the care manager that we've been informed of this drastic change in the definition of case management. We have not been told about this in any type of written form, the details of the changes being made. In the Optum Idaho 2013 Level of Care Guidelines, it states, members have the right to be treated with respect and recognition of their dignity, strengths, and preferences, the right to privacy, and unique recovery and resiliency needs. Members also have the right to information that will inform decision-making, promote participation in treatment, enhance self-assessment, and support broader recovery and resiliency goals. I believe that those assessing services and those providing services should be informed in detail about the changes being made to those services before those changes are implemented. We are not afraid of change. We are happy to accept change when it comes. We need to know what the changes are so we can prepare ourselves and our clients for those changes. Thank you for your time.
Thank you, Dan. Before I invite the next participant up, I'd like to see a show of hands. You know, Dan's testimony dealt with Optum. How many are here to testify about Optum? Okay. Thank you very much.
Mr. Chairman,
Yes.
if I could just add a comment to that. I was in conversation with a provider that's a constituent of mine. They were on the phone for over 7 hours, on hold for over 6 hours of that. So I think it's important that the record show that that is a considerable issue.
Yeah.
Mr. Chairman, I also have some concerns and questions about Optum, and I have researched in the past and I continue to do so.
Thank you very much. We are, as to members of the audience, we are aware of Optum's issues, and we've counseled with Optum. We've gotten promises from Optum, and so we're aware of the Optum situation, and we're trying to resolve those issues for your knowledge. Okay, David? Relax, David.
It's like second generation Marine, and I still gotta, you guys upset me. You guys make me nervous. I can go through bombs and jump off of planes, but I'm David Lonsberry. I'm from Lewiston, Idaho. I'm 58 years old. I have 4 part-time jobs, second generation Marine. And Medicaid, I have a lot of my friends that have passed away the past 10 years. And from lack of Medicaid, lack of help, they sit in their house and they rot. These are veterans. These are hard-working men. I've worked all my life. I've got, like I said, 4 part-time jobs. I work 47 hours a week. Plus, I have 2 jobs on the side that are recycling for this great nation of ours. But I'm concerned that there's no outlook for us older men, the ones that have strengthened this country, that we don't hesitate. I'm still a Marine. My MOS has just changed. But I'd love to go back and fight for our country again. But we don't have the medical support for us. We're scared to grow old. You know what? I held my dad's arms in August. My dad died from lack of medical and stubbornness. But just look at us older men. You know, the newer generation looks to us, but we're the ones supporting. We're the foundation. And we need to be cared for so we can carry on until our last days. And I've had no medical. I'm a healthy individual. I try to stay that way because I've got a mom I got to support, got to take care of. But I just ask that you remember us. You know, older generations need it too. Love you all. God bless.